also is an important entity which we all come across in our day-to-day life as well. And especially being a cardiologist, we are expected not just to be aware to make the diagnosis, but also to be able to manage such kind of patients, in fact. And that's why it is very important for us to be aware what is the real problem. So we will try to have a comprehensive look about the congenital heart diseases in the other lecture, but in this lecture, we'll try to focus on the ECGs. So what are the typical features which we all can identify for these, different congenital heart diseases? For example, so atrial septal defects, we all are aware there are different types of atrial septal defects like ostium primum, ostium secundum. So if we come across this kind of ECG, what do we notice? So I have already given the diagnosis, right? Ostium secundum it is. So what are the peculiar things, characteristics, I would say? So to help you there, we have already put up some arrows as well. Please feel free to use the chat box. What do you notice? So as we already said it to help you, we can already see these are some arrows over here. Any guesses? So for example, how do we start seeing the ECG? So what are the different steps for that? So we start seeing, for example, rate. Okay, this is not a 12 lead rhythm strip or something. So rate, rhythm. mm. Then, for example, what about the abnormalities like the P wave, the QRS, the different segments, and then on an overall basis as well, you can go for the final impression. So let's start with the P waves. So what do you think? How are the P waves? Or the QRS as well? QRS, for example, so P waves looks slightly a bit broader, isn't it? If you will notice, and it does cover a small box at least. For example, especially in the lead 2, if you will notice over here. Okay, and how about the QRS? So there's some arrows as well which has been put up to make it easier for you. So QRS is definitely prolonged, yeah. And then how about the axis, especially in the V1? How is this? Is this normal? Definitely not. So when we look at over here, especially in the V1, so this is what is called as R dash pattern, isn't it? And in the inferior waves, like what is the 2, 3 AVF, as it is pointed out, it is called as there's notched R waves. So what is called as croquetage sign, okay? So this is again crooked sign, which is a notched R wave in inferior leads, can again also be a ECG marker for PFO, okay, patent foramen ovale. And what happens is when there is a R dash pattern with crooked in each of the inferior leads, the specificity of the ECG diagnosis of ASD is remarkably high. So if you come across this crooked sign in the inferior leads, definitely, especially in all three, you can literally close your eyes and you can say it like this. Oh, this is definitely a ASD. Okay. So what happens in the there's already the answer. So this was about the ostium secundum, isn't it? So what about the ostium primum? So primum is the one in which you will see left axis, okay? And here the P waves will be inverted in the inferior leads, in fact, and although upright in the AVL. So if you really want to see, so what do you notice in this ECG? As I already gave you the answer. So if you'll try to look over here, isn't it? One is positive and two is negative. So it is left axis deviation, okay? And especially when we look at the P waves as well, in the inferior leads 2, 3 AVF, it will be inverted in the primum and it will be upright in the AVL. Yeah. How about this ECG? This is a real life scenario ECG. So for which I already gave you an example. So what I had said it is, look for the croquetage sign in the inferior leads. Over here you see it in the 2, 3 AVF already. The lead V1 is also R' pattern, and so this is a typical sign which should make you alert, especially for the sinus venosus. So to summarize a little bit of the algorithm, in fact, we all are aware that ASD can be of two types further, the clockwise loop or the counterclockwise loop. So the clockwise loop again can be of two types. You can say it like this: the ostium primum and the secundum. Okay, so the one with counterclockwise loop is the one with primum ASD. In the primum ASD, LAD will be there. Okay, left axis deviation is going to be there, and notching of the S waves, especially in the inferior leads, we are going to notice. However, in the clockwise loop, as I said it, there can be further two types as well. So one can be the secondum ASD. Secondum ASD, what did I say?